No doctor in America today exists on their own. They are part of a team, and the patient is best cared for as being part of that team. And the healthcare system does not make it easy for those teams to work with one another, nor to work with other teams in other settings. It is not reimbursed, and therefore one must jump through multiple hurdles in order to affect that kind of communication and coordination. And very often, the patient and their families are the people who are left to try to coordinate their own health care.
Several of the insurance policies that were aimed at keeping costs down have actually impeded the opportunity for professionalism. And let me give you one example. In the practice of requiring pre-authorization before a primary care physician could send a patient to a specialist for a consultation or a procedure, actually caused a huge disconnect between the primary care physicians and the specialist. Over the years, what this has done has actually dumbed down the primary care physician who does not know what the newer aspects of the specialist care might be, what the specialist might benefit from having from the primary care physician, what tests and workups could be done before the patient is referred to the specialist. As a consequence, the specialist view of the primary care physician is diminishing, and they see the primary care physician as less competent. If the value of competency is a part of our medical professionalism, that is maintaining our competency over time, it becomes incredibly incumbent upon us to interact with each other and know what each other is doing and what is important to each other, creating that culture of the specialties interacting.
When I was trained, the value was absolutely on individual competence. And in fact, we were taught, literally explicitly taught, don't trust anybody. You have to read all x-rays yourself. You can't trust someone else's diagnosis from another specialty, that you're the only one who can really take care of your patient. The problem is, of course, that we don't function individually anymore. I'm not sure we did back then, but we certainly don't anymore. And what we've come to understand is that it's actually the ability to work within a team that will improve patient outcomes. And now the literature supports the fact that teamwork communication skills are really important in error prevention.
When I was in the UK, I found that they're very proud of their community health nurses, and they rely on them greatly. That's something we could certainly talk about here, where physicians would be working closely with nurses in a way that is not antagonistic, is not worried about scope of practice, but embodies that all of us do the best that we can to the extent of our training.
In order now, in this complex environment, in order to provide good care for anybody, you have to trust other people. It's physically impossible to do everything for a patient. That's just, I mean, you can't. How do we let go of the bad side of invulnerability and personal responsibility and autonomy without throwing the baby out with the bathwater? Can we preserve that sense of, I care so much about what happens to this patient that I am willing to go the extra mile, knowing that it's got to take more than my going the extra mile to make it work, and that if I run into trouble, I have this community who can help me puzzle it out.